First of all, I want to say thank you for being patient with everybody, and to the directors that are still here, you did an awesome job. My name is Sonia Lyles, but everybody knows me as BB. I am the director of the CHR and EMS programs, and I am also a nationally registered emergency medical technician. Medical. All right, first slide. All right, community health representative is our acronym is CHR. We are here as an advocate for Native American individuals and families to gain access to comprehensive health care services. We are also here to serve as a facilitator in the implementation of treatment plans and provide supporting services designed to enhance the quality of life for the people that we serve. On that note, I do want to let you know that we are also federally funded through Indian Health Service under Section 108, Public Law 93-638. That grant is available to all Native Americans who live within our jurisdiction. I am here speaking to you today on behalf of gaming funding. All right, on this slide, it's for emergency medical services. Like I said, we are both CHR and EMS. We provide emergency response within a specific geographical boundary while working in conjunction with both local ambulance services and volunteer fire departments. So to reiterate on who qualifies for our program, once again, it is any Native American that lives within the counties of Comanche, Cotton, Tillman, and portions of Caddo, Jackson, Jefferson, and Stevens County. Now, that is part of my federal grant. The gaming money that I am asking for is for $300,000. On that note, that money will be used to fund Comanche tribal members who live not just within this jurisdiction, but other counties as well. Services that we provide. We provide transportation to and from doctor's appointments, both routine and specialty, as well as disability appointments. And this typically includes the local cities around here, whether it be Anadarko, Lawton, Duncan. I think that's about as far as local cities we go. But we also transport to Oklahoma City, Edmond, Norman. Oh, actually I have Edmond in there twice. And El Reno. El Reno is mainly based for our disability appointments. Depending on what disability they're going for, they tend to go to Oklahoma City or directly to El Reno. We also provide transportation to and from dialysis. We host rabies vaccination clinics at least 3 times a year, and we do work in conjunction with the Lawton Indian Hospital, the Office of Environmental, and the Fort Sill Veterinarians. And when we have these rabies vaccination clinics, this is a free service that the veterinarians come out and provide. We also do medical standby for various events. And it does say powwows, gun range, and disasters. Powwows, that includes the Comanche Tribal Fair, homecoming, and any other powwow that we're requested at. The gun range, we tend to stand by for this service just because we want to make sure everybody is protected and safe. Disasters, we are part of the emergency management team. This does include flooding, tornadoes, anything that is pertaining to a disaster. We also host fire extinguisher trainings. We also have blood pressure and blood glucose training. And the bottom one, I apologize, is a little hard to see, but it is also emergency medical response. Okay, this one is staff trained in the following areas. I do have, besides myself, I have 8 other employees. 2 of them happen to be part-time at this time. But with the staff, we are all trained. I have 1 that is an EMR. I have 3 that is an EMT, 1 that's an EMT intermediate, a CNA, and an LPN. We also have a state licensed police officer on hand. I have staff that is trained not just in hazmat awareness, but Hazwoper as well. We are also trained in manual blood pressure and blood glucose, and that is something we are required to retrain in every year and be certified. I also have staff who are wildland firefighters, and this is both for BIA and the state of Oklahoma. I've also got staff who are structure firefighters, assault operators, and we also have staff that is trained in search and rescue and body recovery. I have had staff who has done this on 2 occasions. 2013, when the tornadoes hit Moore, we were there, and then recently last year when the little boy from Duncan went missing. We had a mission, and it was to recover a body. These are some goals that we have for our department. Currently, we are located at the Keith Yacchione Health Programs building right behind optometry. We would like to relocate back to the Comanche Nation Complex. We would also like to acquire Greer County under our jurisdiction. Currently, it is an unclaimed county within the CHR jurisdictions that are all funded through Indian Health Service. We would like to obtain a medical director. We would also like to become a state certified response agency with individual protocols and to start our own ambulance service. The reason we need to relocate back to the complex is so we can become a state response agency and get the medical director. Once we get a medical director with individual protocols, any emergency that we have on the complex grounds, whether it be an employee getting dehydrated, we can have those individual protocols in place. Therefore, we can treat on site, reduce the time of an employee having to go to the Lawton Indian Hospital or whichever clinic they may use. We treat on site, they're more likely to get back to work and increase productivity. Here is our contact information. Like I said, we are located at the Keith Yacchione Health Programs building, number 1 Southwest D Avenue. The easiest way to find us is we are at the corner of Railroad and D, just down from Pike Pass. Our main office number is 580-699-5225. Before I go any further, I want to explain to everybody about our phone calling system. This main number here rings to all of the phones in our office. However, if we should call you and when it comes up as a different number, and I apologize for that. People try to contact that number back. I'm pretty sure y'all have the same problem. Unfortunately, we do not know where this phone number rings to, so therefore we get the complaint that nobody answered the phone. I apologize for that. We're still trying to work on getting that fixed. Our fax number is down below, and then of course this is my work email. I apologize if you can't see it. It is all lowercase, SONYAL @ComancheNation.com. This is our current office hours. We are Monday through Friday from 7 a.m. to 6 p.m. We are looking to change this to 10 p.m. here soon. The next one is our CHR EMS staff is on call 365 days a year, 24 hours a day. At the bottom it says no matter what the weather is, we are here to serve. My staff is on call, like I said, 24 hours a day. The hospital does not stop for anybody. If you should have an emergency and you need to go, please call our department. We are more than happy to come get you. We've picked up people as late as 10 o'clock and as early as 2 a.m. A lot of times people can't afford an ambulance. If it's a non-life-threatening emergency and we are able to take you, we will transport you. This is the reason we would like to eventually get our own ambulance service, so you don't have to worry about that problem. We are already at the last slide. Well, questions, comments, concerns? Yes. Can you go back to Can you see it okay? And whenever we transport people to their appointments, I want to let you know that, we try to get you there at least 15 to 30 minutes in advance. That way you have time to sign in, fill out any paperwork if you're a brand new patient. Yes. We have some that will call that morning of because of how the Indian hospital functions. They have the same day appointments, walk-ins. You can call that day. Now, however, if you know that you have an appointment coming up 3 months, 6 months out, you are still welcome to call that far in advance and we will go ahead and get your appointment taken down. Yes. just tell her to call whenever she gets the appointment, and I apologize for any misinformation that you may have received. I believe I know which one you're talking about because we did just speak to her recently and we got her set up. What we can do is if she happens to ride transit and gets the appointment and may not have a way back, she is still welcome to call our department and we will take her home. Yes, and the town of Apaches actually has one CHR from the Fort Sill Apaches. However, it's hard to get in with her. You are more than welcome to call our department. We do have a dialysis patient that we service there, and we do still go ahead and come into the area and service Comanche members. So you're more than welcome to call. Anything else?
Questions? Thank you, Bibi.
Thank you.
Next, if we could have the WEA program come up.